Hey everybody, this is a clip from the latest episode of the Randi Rhodes Show. If you want the full episode, you can watch live on Free Speech TV, Dish Channel 94.
Mary had a little man.
The fault. We believe that all men are created equal.
To the magnificent mosaic that is America.
From radio beacon to radio beacon. I have a dream today. Change has come to America.
Believe me.
Knock, knock. Who's there?
It's a figment of your imagination.
Randi Rhodes Show.
Turn up your mind.
Could you explain the gap for the American people and what you're saying here today about there being tens of thousands of tests available, about how there being a huge amount of masks available, and what we're seeing on the ground, which is really the opposite of that? People are saying that they can't get tested even when they have symptoms. People are saying that doctors are telling us they don't have access to vital equipment. Can you explain that gap?
I cannot explain a gap. I'm hearing very good things on the ground, and we're dealing with love. They had to ramp up. They had an obsolete system, and they had a system simultaneously that was not meant for this. It wasn't meant for this. Nobody knew there'd be a pandemic or an epidemic of this proportion. Nobody's ever seen anything like this before. I can tell you that what we're doing is we're working with local governments, with states, governors, even mayors, on getting them to be able to get what they need. And the system is starting to work out very well. But we had to break a system, like breaking an egg, because the system we had was obsolete and didn't work. And that was a system we inherited.
Okay, so he's lying clearly there. And we know that because today there is a blockbuster report that clearly shows that the Trump administration at Health and Human Services on October of 2019 started a fictional pandemic so that they could practice for a fictional pandemic named Crimson Contagion. It was a simulation by the Department of Health and Human Services. It was a series of exercises that ran from last January until August, all right? The simulation had the same exact results that we're seeing now. They had a draft report that they released in October that has never been previously reported. David Sanger from the New York Times, who is, the national security reporter for the New York Times, was able to get hold of this report. And he said the report drove home just how underfunded, unprepared, and uncoordinated the federal government would be in a life and death battle with a virus for which no treatment existed. And he said it was marked not to be disclosed, but it laid out in stark detail repeated cases of confusion, federal agencies jockeying over who would be in charge, state officials, local hospitals trying to figure out from the feds what kind of equipment they had stockpiled, what kind of equipment they would make available. Cities and states at the end of this exercise concluded that they were on their own and that they would have to close their own schools. They would have to manage their own lockdowns. They would have to manage their own health systems without the federal government. And you know what happened to this report? Trump was not interested in it. He wasn't interested. They didn't look at it at the executive office, and it was already modeled for him. They understood at Health and Human Services the trajectory of a pandemic, a virus that had no treatment and no test. They understood it. The administration was not interested. Now, Donald Trump keeps saying, quote, nobody knew there would be a pandemic or an epidemic of this proportion. No one's ever seen anything like this before. The truth is that our government has, over the past 5 years, demonstrated that the government of the United States had considerable knowledge about the risks of a pandemic and accurately predicted the very types of problems that Trump is saying no one could have known about. Crimson Contagion was conducted last year in Washington. It included 12 states, including New York and Illinois, and it showed that federal agencies under Donald Trump who disbanded the Obama effort like planning and thinking never got sufficient attention inside the executive branch or by the Republican Congress. Now he lies. Nobody ever thought of numbers like this. You know, as early as George W. Bush in 2009, Homeland Security and health officials knew about big gaps in the American response to biological attacks, which this is not. And then in 2009, after a few months of President Barack Obama's very first term, a 10-year-old California girl was diagnosed with a contagious disease that was caused by North American pigs called the swine flu, which became the H1N1 flu epidemic, the first flu epidemic, first flu pandemic in 40 years. In 40 years. And because of that, and then in 2014, the outbreak of Ebola in West Africa, and the fear that that could spread to the United States, because it was much more deadly than the flu, but it wasn't as contagious, but Obama was on that wall, and he decided that he would send 3,000 troops to Africa to contain that disease. The containment of Ebola was considered a success, but the White House under Obama also knew that they had gotten very lucky. And so they decided to set up an Ebola task force. They put Ron Klain, who was Vice President Joe Biden's chief of staff at the time. Ron Klain, you see him on TV all the time. Ron Klain is a friend of my family's, actually, and Ron Klain will likely be Joe Biden's chief of staff when Joe Biden becomes the 46th president of the United States. Anyway, they were on this before a single case in the United States. Congress allocated $5.4 billion in emergency funding to pay for Ebola treatment and prevention efforts here in the United States and in West Africa. And that money is the money that helped finance a little-known agency inside Health and Human Services in charge of preparing for future contagious disease outbreaks. That is the office that ran the 2019 Crimson Contagion exercise that I'm talking to you about, that David Sanger in the New York Times published today. We lost one guy in the Ebola epidemic. It was a Liberian citizen. He became the first person in the United States to be diagnosed with Ebola on American territory. It was in September of 2014. He died, but the two nurses that treated him recovered. And that was the only death we had in the United States. And now we have deficiencies in equipment. We have deficiencies where we don't have gloves. We don't have masks. We don't have gowns. We don't have any of the basic supplies that this exercise clearly demonstrated would be in short supply and tried to alert the Trump administration about. The other thing that came out of this was that they created a dedicated office inside the National Security Council to coordinate the response because they realized Trump was not a leader. And they left it to him. And John Bolton was told to dismantle it. John Bolton was told to get rid of it. It was the Global Biosecurity and Health Directorate. And they dismantled it. Donald Trump did. Hey, everybody. This is a clip from the latest episode of The Randi Rhodes Show. If you want the full episode, you can watch live on Free Speech TV, Dish Channel 94.